Hello, my name is Dr. Eunice Wang at the Roswell Park Comprehensive Cancer Center. This ASH meeting, I'm pleased to present the results of the Phase 3 LACE-WING trial. This was a Phase 3 randomized controlled trial for patients with AML who have a specific mutation in the FLT3 gene, but who were considered ineligible for intensive chemotherapy. Now, about half of our patients presenting with AML are ineligible for intensive chemotherapy, either because of their age or other comorbidities, and those who have that FLT3 mutation are not eligible to get the standard regimen of intensive chemo and a FLT3 inhibitor. This trial is closed, and this is to present the interim analysis results. The trial was actually stopped at that point because of a lack of difference between the two groups. Patients in the LACE-WING trial were randomized to receive, at the time of their diagnosis, either a FLT3 inhibitor, gilteritinib, which is currently approved for people in the relapse refractory setting, plus a low-dose chemotherapy, azacitidine, as opposed to azacitidine alone, which up until recently has been the standard of care. So patients were randomized 1-to-1 at the final iteration of the trial to receive either gilteritinib, azacitidine, or azacitidine alone. So the interim results of this trial showed us that there really was no difference in the overall survival between the two groups. However, there were some signs of activity or some enthusiasm that we can glean from these trial results. First of all, many of the patients that got the azacitidine alone, when they went off trial, actually went ahead and got FLT3 inhibitor therapy sequentially, including a number of them getting gilteritinib. So part of the difference in the overall survival not being significant could have been due to confounding factors like that, as well as the fact that the patients who got the combination arm tended to be a little bit sicker than the ones in the control arm. We saw that patients who had a high degree of what we call FLT3 mutant burden or high FLT3 allelic ratio seemed to benefit from the gilteritinib azacitidine. And encouragingly, when you looked at the overall response rates, meaning complete remission and other clinical evidence of response, there was a much higher rate of response, over 50%, in the patients getting the combination arm than those getting azacitidine alone, suggesting that there was potential for there to be activity and benefit in those patients. The drug combination of the two agents was safe and was tolerable, no new safety signals, so there may be activity or a promise in bringing combination azacitidine and FLT3 inhibition further and to explore other studies in a similar patient population. So this trial was halted at the interim analysis as the main endpoint was the overall survival, and there really was no difference. What we're doing now is actually looking at future combinations. So since this trial was opened, this drug venetoclax, a BCL2 inhibitor plus azacitidine, has become the standard of care for all older unfit patients with AML, regardless of their mutation type. So the current next step forward is to say, can we give gilteritinib, azacitidine, and venetoclax in a triplet therapy to further enhance and bolster that increased overall response rate and activity that we've seen, and bring together the elements and the response rates of all three drugs to potentially bring greater benefit to patients in this category. So we're looking forward to those types of what we call triplet studies or double targeted therapies moving forward.